Jet fuel and antiseptic smell almost identical if you've spent enough time in both places. The difference is what's underneath. In a forward operating base, the fuel masks blood and fear. In a hospital laundry room, the antiseptic masks everything the sheets have already seen. Lennox had learned to stop noticing either one. She was folding blankets at 0640 when the charge nurse found her, not because anyone needed blankets folded. Mercy Ridge Regional didn't have a linen shortage, but Lennox had come in an hour early because sleep had stopped being a reliable option somewhere around 2019, and folding gave her hands something to do that wasn't shaking. "You're on float again today." Devereaux said it the way people announce minor inconveniences. A broken stapler, a delayed coffee order. She didn't look up from her clipboard. Devereaux was the kind of nurse manager who wore her authority in the set of her shoulders. Tight, permanent, defensive. She had worked at Mercy Ridge for 19 years and believed that seniority was its own kind of expertise. "We need coverage in the surgical step-down. Keep the AWBUS charts current, do your hourly checks, and stay off the IV pumps, unless someone specifically asks you." "Understood," Lennox said. "The core staff has it managed. You're just filling a body count." Lennox set the last folded blanket on the pile and said nothing. She had stopped explaining herself years ago. It cost too much energy that she didn't have. The surgical step-down unit at Mercy Ridge was shaped like a long gray corridor with aspirations. 12 beds, a nurse's station that smelled of burned coffee and hand sanitizer. A whiteboard covered in dry erase marker that nobody had fully erased since at least Tuesday. The patients were post-surgical recoveries, mostly. Hip replacements and appendectomies and the odd bowel resection that still made the newer nurses go pale during dressing changes. It was not a dramatic place. That was precisely why Lennox had chosen it. She had spent 7 years as a tactical medical technician, attached to a joint task force 2 support element, rotating through phobes in Mali and Latvia, and one very quiet, very terrible month in a location that still didn't officially exist on any deployment record she had ever seen. She had managed hemorrhagic shock in the back of a light armored vehicle while the vehicle was still moving. She had performed a surgical airway on a man whose face had been rearranged by a door-breaching charge, using a field kit and a headlamp, and nobody helping her, because everyone else in the room was either dead or busy making sure they stayed that way. Now she checked blood pressure readings on a 63-year-old retired postal worker named Mr. Thibbert, who had just had his gallbladder removed, and she was good with that. She was genuinely, profoundly good with that. The step-down unit hummed. The monitors beeped in their patient, metronomic rhythms. Down the hall, one of the core nurses, a young woman named Pelletier, who had finished her BSCN 14 months ago and had not yet developed the useful skill of hiding her expressions, was arguing quietly with a pharmacy runner about a missing order of ondansetron. Normal, all of it normal. Lennox moved from room to room with her clipboard, checking rates and pressures and respiration, existing in the pleasant beige middle distance of a job that asked nothing of her she wasn't willing to give. She was in Bay 7, checking the surgical drain output on a 48-year-old woman recovering from a Whipple procedure when she felt it. Not heard. Felt. It started in the soles of her feet, a low rhythmic resonance coming up through the concrete subfloor, through the linoleum, into the rubber soles of her hospital shoes. She went very still. The woman in bed 7, Mrs. Arsenault, was telling her something about her daughter's upcoming wedding in Prince Edward Island, and Lennox heard none of it because every animal part of her brain had snapped to attention with a speed she had no control over. Rotary wing. Heavy. Multiple aircraft, not the medevac helicopters that occasionally landed on the roof pad. She knew that sound too, the high nervous chop of a civilian air ambulance, the kind that fluttered and whined. This was something else. This was displacement. Massive, rhythmic, mechanical displacement, the kind that comes from a main rotor, designed to carry 22 fully equipped soldiers through an active threat environment. Her hands stopped moving. Her pen hovered over the drain output chart. Mrs. Arsenault was still talking about flower arrangements. "Excuse me," Lennox said quietly. She set the clipboard on the bedside table and walked out into the corridor. Through the window at the end of the hall, past the parking garage and the access road, she could see the trees on the ridge, behind the hospital moving wrong. Bending in a hard circular pattern, she counted the rhythm. Thump, 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 pause. Thump, thump, thump. 2 aircraft, possibly 3. Flying low, flying direct. Civilian helicopters circle. They announce themselves. They negotiate airspace. Military aircraft arrive. She pressed her back against the wall and told herself very firmly that it was not her problem, that whatever was happening was a long way from surgical step-down, that Mercy Ridge had an emergency department with trained physicians and a trauma protocol, and none of this had anything to do with blanket folding and OBS charts and the pleasant beige middle distance she had worked so hard to build around herself. Her left hand was flat against the wall. She noticed that her right hand had balled into a fist at her side. She hadn't told it to do that. The hospital intercom crackled. A voice she didn't recognize, someone from the main ER 2 floors down, and the words came out clipped and unsteady. Code orange. All available clinical staff to emergency. Repeat. Code orange. This is not a drill. Code orange. Mass casualty. The corridor around her went briefly, absurdly normal for about 4 seconds. The monitors kept beeping. The dry erase board said what it said. Pelletier looked up from the pharmacy argument with her mouth open. And then everything accelerated. Footsteps. Intercom again. Devereaux's voice somewhere overhead, sharp and reorganizing. The elevator bank down the hall chimed twice. Lennox did not move. She stood with her back against the wall and her right hand in a fist, and thought, very deliberately, "You are a float nurse. You are coverage. You are a body count." Devereaux said so herself. "You stay where you're assigned. You do not go downstairs." She thought this for approximately 45 seconds. Then she went downstairs. The emergency department at Mercy Ridge occupied the entire east wing of the ground floor, and when Lennox pushed through the stairwell door into the lower corridor, the smell hit her before anything else. Jet exhaust, bleeding through the ambulance bay ventilation. Cold and sharp and oily. She knew that smell the way she knew the smell of her own fear, which was also present, currently, at moderate and rising levels. The ER was operating at the frequency of organized panic, not chaos. The staff were too trained for full chaos, but the particular pitched anxiety of people who had run the mass casualty simulation twice and were now discovering the simulation had been optimistic. Crash carts were moving. Curtains were being yanked. Someone was on the intercom calling for O-negative blood from the bank. Dr. Sauvé, the attending, was standing in the middle of the floor with both hands raised, trying to direct traffic, and the traffic was not listening. The ambulance bay doors were open. Lennox stopped at the edge of the ER floor, behind the nurse's station divider. She could see through the bay doors into the gray morning outside. The rotors were still turning, She could feel them more than hear them over the internal noise. And there were 3 vehicles she couldn't quite make out, dark and low-slung, parked at aggressive angles in the ambulance access lane. Then they came through the doors, 5 of them, cadpat pattern, arid variant, dusty in a way that no Canadian training exercise produced, because the dirt was the wrong color for anything within 3,000 kilometers of Mercy Ridge. Plate carriers, communications gear, 2 of them carrying a litter between them at a pace that made the Mercy Ridge staff scatter sideways without being asked. The man on the litter was alive. Lennox assessed this in approximately 1 second from 15 feet away. Chest rising, but asymmetrically. Left side barely moving. Right arm tourniquet, mid-humerus, applied tight and correctly. Blood pressure would be problematic but survivable if someone addressed the chest in the next several minutes. The lead operator. She clocked him as lead by how the others moved relative to him. Slightly behind and slightly to the outside. A formation so automatic they probably couldn't have described it. Put himself in front of Dr. Sauvé with the calm, absolute authority of someone who had never once in his adult life considered that another person might not do what he said. We need trauma capability, now. His French-Canadian accent was thick, stressed flat by urgency. He had dark eyes and a beard that had gone well past regulation, and the particular 1,000-yard focus of a man operating on adrenaline and will and not much else. "This is a community hospital," Sauvé said. He was trying. To his credit, he was genuinely trying. "We have a level 2 trauma designation. If your patient needs a level 1, there's a trauma center in the city, 40 minutes by." He doesn't have 40 minutes. The operator didn't raise his voice. That was somehow more frightening. He has a tension pneumothorax developing on the left side. He needs needle decompression and a chest tube. Your trauma center is useless to him right now. "Who is your most experienced trauma physician?" Sauvé said. "That's me," with a confidence that Lennox recognized as genuine and also, in this specific situation, insufficient. The operator looked at him for 1 moment. Just 1 moment of assessment. Then he looked past him. He looked at the nurse's station. He looked at the 2 residents frozen near the supply cart. He looked at Pelletier, who had followed Lennox downstairs and was now standing directly behind her, and he looked past Pelletier too. "Where is Ridgeline?" he said. The room did not go quiet the way a room goes quiet in films, all at once and dramatically. It went quiet in pieces, monitor by monitor, voice by voice, until the only sounds were the ventilation system and the wet, labored breathing of the man on the litter. Lennox did not breathe. Ridgeline. She had not heard that name in 3 years, 4 months, and an indeterminate number of days. She had stopped counting, because counting made it worse. She had walked away from it the same way she had walked away from everything. Quietly, in the middle of the night, with a kit bag and a medical release and a very firm intention to become someone who folded blankets and checked UBS and did not know what jet fuel smelled like from the inside of a burning vehicle, she pressed herself back into the divider. She was wearing generic green scrubs, the kind that came from the hospital supply and fit nobody well. Her hair was in a bun. She had no name tag on because the float nurse name tags lived in a basket at the main nursing desk, and she had forgotten to grab one when she came in early. She was, to any observer, simply a person standing near the nurse's station with no particular distinguishing characteristics. She thought, "He doesn't know you here. He can't know you're here. There are 40-something clinical staff in this room, and he's looking for a ghost." The man on the litter's breathing changed. It shifted from labored to something worse. Shorter, more effortful. His lips, already pale, took on a faint grayish undertone that Lennox could read from across the room the way other people read newspaper headlines. Tracheal deviation was beginning. She could see it. The subtle, terrible leftward shift at the base of his throat, the compensatory tension in the neck muscles. He had minutes, maybe less. The lead operator turned in a slow circle. His eyes were systematic. He was scanning faces, not bodies. Ridgeline. He said it again, louder. Not a question, a demand directed at the room. I know you're in this hospital. Dispatch pulled her credentials from the provincial registry 40 minutes ago. She's here. A pause. I need her right now. Dr. Sauve said, I can perform a needle decompression. Then do it, the operator said, while I find my medic. Sauve moved. To his credit, again he moved. But his hands were searching for a 14 gauge, and his eyes were on the wrong side of the chest. And Lennox watched him make the assessment error in real time with the clinical detachment of someone watching a trainee perform a skill they had taught 300 times. Wrong side. The tension was left. He was setting up on the right. In his urgency, in the noise and the pressure, he had lateralized to the side with the better access, and not the side with the problem. And if he pushed a needle into a chest that didn't need decompressing while the other side killed this man, the outcome would be both tragic and preventable. And Lennox would spend whatever remained of her life, knowing she had watched it happen from behind a nurse's station divider. She pushed off the wall. She didn't announce herself. She didn't say anything to anyone. She walked across the ear floor at the specific pace, not running, never running. Running creates panic, and panic creates errors that she had developed over years of moving through environments where moving wrong could get people killed. She arrived at the bedside. She put her hand on Sauve's arm, gently but definitely. Left side, she said. Sauve looked at her. Excuse me, you're the float nurse from left side, doctor. She kept her voice quiet. Trachea is deviating left. The tension is on the left. Feel his right chest wall. It's hyperresonant because it's compensating. The injury is on the left. Sauve's hand went to the chest. She watched his face process it, watched him find the resonance difference, watched him believe her. He stepped aside. The operator had gone completely still. Lennox did not look at him. She was already gloved. She'd grabbed gloves from the dispenser as she walked past. A motion so automatic she hadn't registered doing it. And she was oriented to the left chest wall, finding landmarks by feel, because she'd done this in darkness and in moving vehicles. And once, famously among people who had been there, lying flat in a drainage ditch, with her headlamp broken and her hands working entirely by memory. I need a 14-gauge angiocath, she said, not to anyone in particular, but with the particular tone that resulted in someone immediately providing a 14-gauge angiocath. Pelletier put it in her hand. Second intercostal space, she said, more to herself than the room. Mid-clavicular line. Her fingers found the angle of Louis, walked down one space, found the second rib moved lateral. She uncapped the needle. The man on the litter, his name tape read Bouchard, which she filed and did not acknowledge, was conscious. Barely, but conscious. His eyes tracked to her face. This is going to hurt, she said. You've had worse. Something in his expression shifted. The barest edge of recognition, not of her face but of the way she had said it, the absolute, earned certainty of someone who knew precisely what worse looked like. She drove the needle in. The hiss of released air was immediate and significant, loud enough that Pelletier took a half step back. the pressure in the pleural space venting through the catheter, the pathological buildup that had been compressing Bouchard's heart sideways in his chest, escaping into the room with all the pent-up urgency of something that had been trying to kill a man for the last 45 minutes. Bouchard's next breath was different, deeper. The gray tinge around his mouth shifted back toward something that was not gray. "O2 SATs are climbing," said one of the residents from the monitor he'd moved himself to without anyone asking him to. "Good. Useful." She filed that too. "Temporary fix," Lennox said. "He needs a chest tube before that needle track closes, and someone needs to reassess that tourniquet. The tissue distal to the band is starting to show reperfusion signs." "How long has it been on?" 90 minutes, said one of the other operators, speaking for the first time. His voice was controlled, but the control was costing him something. "Maybe 95. You'll want vascular surgery standing by," she told Sauvé. "The limb is viable, but the window isn't generous." She was already accepting the chest tube tray from Pelletier, already finding the 5th intercostal space, already having the specific conversation with herself that she had every time. This is going to look like violence. It is not violence. It is the thing between this man and the alternative, before making the incision. The room had gone to a different kind of quiet. Not the panicked silence from before. This was the quiet of people watching something they didn't have a framework for. A kind of competence they recognized but couldn't place. Like hearing a piece of music played at a tempo you'd never encountered and understanding, somehow, that this was the right one. Sauvé assisted without being asked. That said something about him that Lennox would think about later. She placed the tube. She directed the drainage. She stepped back when the pleurivac was running, and the drainage was appropriately dark. And the chest wall was moving symmetrically, and Bouchard's blood pressure, relayed by the resident at the monitor, was climbing toward a number that suggested he was going to be able to keep using it. "He needs the ore," she said to Sauvé. "The chest is managed for now. The limb is your next priority. Do you have vascular on call? 20 minutes out. He can wait 20 minutes. She stripped her gloves. "Call them now and tell them what they're coming into, so they're not starting from zero when they walk through the door." Sauvé was already on the phone. The operators were pulling back from the bedside as the Mercy Ridge staff moved in, performing the same organized handoff she had seen done in vehicles and staging areas, and once memorably in a school gymnasium in a country she didn't name in conversations. The choreography of handing a critical patient from the people who'd kept him alive in the field to the people who were going to keep him alive in the facility. It had a shape. You learned to recognize it. The lead operator was standing at the edge of the ER floor. He was looking at her. Lennox walked past him. She was heading for the staff washroom down the corridor because her hands were bloody and she needed to stand somewhere that wasn't this room for 60 seconds. Just 60 seconds. And then she would go back upstairs and Mr. Tibbert would need his 4 o'clock obs done. And Mrs. Arsenault would probably want to tell her more about the flowers. Ridgeline. She stopped. She had her hand on the washroom door. She didn't turn around. "My name is Lennox," she said. "I work in surgical step-down." She heard him come up behind her. He stopped a respectful distance back, which surprised her. She'd expected the full press. She turned around. Up close, with the adrenaline of the room receding slightly, she could see how tired he was. Not the tactical fatigue of an operation that she knew. This was something longer, something that had been accumulating. His eyes had the look of a man who had been making decisions in situations with no good options for long enough that the weight of it had started to show in the bones of his face. She didn't know him. That surprised her. She had expected someone from her unit, some face she'd filed away. But she didn't know him. "You were attached to Task Force Copper," he said. 2021 to 2023. The medic they called Ridgeline. It wasn't a question, but it had the shape of one. "Who are you?" she said. "Bernier." He said it the Quebec way, soft on the second syllable. "We worked parallel on Operation Frank. We never met. But Bouchard talked about you. After you got him out of the vehicle at checkpoint 7. He paused. "He said you threatened to break his jaw if he went unconscious before you finished the tourniquet." "He was being dramatic," Lennox said. "I said I would flick him in the forehead." Something moved across Bernier's face that was not quite a smile, but came from the same place smiles came from. "He's going to live," she said. It wasn't a question either. "The tube is running clean. His pressure was responding. You've got vascular coming. If there are no surgical surprises, he's going to live." "I know," Bernier said. "Because of you, again. He did the hard part. He stayed alive long enough to get here." Bernier reached into a side pouch on his carrier and removed something. He held it out. A small subdued patch, the kind worn on training kit rather than operational gear. A maple leaf, dark green on dark background, with a thin white ridgeline running through it horizontally. She had worn the matching one for 2 years. She had left it in a Tim Hortons parking lot in Petawawa in a bag with the rest of her kit when she had signed her medical release papers and driven away without looking in the rearview mirror. She looked at it for a long moment. She did not take it. "I'm on UB's rotation until 1500, she said. "After that, I have to restock the isolation cart on floor 3. Bernier nodded slowly. He closed his hand around the patch and put it back in the pouch. "The helicopter scared you," he said. It was not unkind. It was the observation of someone who had watched a lot of people manage the same distance between who they had did and who they were trying to become. "Everything scares me now," Lennox said. "I've just had a lot of practice not showing it." Bernier looked at her for a moment. Then he said, "For what it's worth, Ridgeline, you still moved faster than anyone in that room, including the doctors." "My name is Lennox," she said again. "Quieter this time." "I know," Bernier said. "Good to know where you are." He went back through the ER. She heard the bay doors. The rotors outside, which had been idling, began to spool up. Not all of them, just one, moving away. And then the sound receded, taking the vibration in the floor with it, until the only thing left was the baseline hum of the hospital doing what hospitals do. She pushed the washroom door open and ran the water scalding hot the way she always did, and scrubbed with the rough soap that smelled like industrial citrus and nothing like anything she wanted to remember. The water ran pink, then pale, then clear. She braced both hands on the edge of the sink and looked at the drain until her breathing leveled. She thought about Bouchard, his name tape, the way his eyes had tracked to her face, the particular recognition, not of her, but of how she'd spoken. "You've had worse." The economy of it, the trust it required to say something like that and be believed. She thought about the 2 years she had spent in surgical step-down, in float pool shifts and overtime OB's rotations, and the particular small satisfaction of a drain output chart completed accurately and on time. She thought about how she had assembled this life the way you assembled a shelter in a field. Not beautiful, not permanent, just functional and defensible and hers. She thought about how none of that had been wrong, how wanting to be left alone was not the same as being broken. She dried her hands. The mirror above the sink showed her face, which was the same face it always was. A little older than it had been in Petawawa, a few lines around the eyes that had not been there before. The expression of someone who had learned to keep most of what they thought behind glass. She turned off the tap. She straightened her scrubs. She tucked a strand of hair back into her bun. Floor 3 was going to need that isolation cart restocked before the evening shift came on. Mr. Thiebert's 4 o'clock ubs weren't going to chart themselves. Pelletier had looked shaken earlier, in the way that new nurses sometimes got when something real happened faster than their training had suggested it would, and someone should probably check in on that. Lennox opened the washroom door and stepped back out into the corridor. The Mercy Ridge Emergency Department was resuming its baseline frequency. The code had been downgraded. The monitors were beeping their patient, metronomic rhythms. Someone was on the intercom about the blood bank, down by the nursing station. Devereaux had appeared and was standing with her clipboard, her face doing the particular thing it did when events had exceeded her organizational framework, and she was deciding how to file them. She saw Lennox come out of the washroom. Her expression shifted, opened slightly. Harper. Devereaux's voice had lost its sharp administrative edge. Not all of it. Enough. Lennox looked at her. The attending wanted me too. Dr. Sauvé wanted to know if you were available to consult on the surgical case going forward. Lennox considered this for a moment. Outside, far away now, and getting farther, she could just barely feel the last of the rotor vibration fading from the floor. "I'm float," she said. "Tell him I go where the board sends me." She picked up her OBS clipboard from the nurse's station counter where she'd left it. She went back to work.